What's up, YouTube? Welcome to another episode of the Undergrad Forum. Now, this is the beginning of what's going to be the third year of medical school series. If you remember from watching my channel before, the first 2 years of med school, remember that's all like in the classroom, basic science learning, and then years 3 and 4, you're in the clinic every day on rotations, and you'll be seeing patients, taking care of them, learning from your patients, and reading, and that's kind of how the medical school breaks down. And now we're going to start a series on third year. So if you remember during the first and second year videos, we had videos on how to study for pharm, how to study for micro, path, physio, anatomy, etc. And we had books and we had techniques, we had videos on how to study like efficiently, and all those are on the channel, so you can take a look at them. Now we're going to start a new series on how to study in third year and how to do well like on your rotations. If you didn't know, rotations, like during third year, for example, you have core rotations you'll be on for whatever weeks of time. You'll be on like an inpatient service, taking care of patients who are in the hospital, being taken care of by medicine team. You'll be on surgery, you'll be on OB-GYN, peds, psych, etc., neuro if your school does it during third year, ER, etc. So all of the medical specialties, to a certain degree, you'll be rotating on, and you'll take electives to things you're interested in. So today, let's talk about how to do well on the internal medicine rotation, family medicine, and ambulatory. These are three different things, but we're going to kind of group them together because they're so similar. So how to do well on the rotation, like every day, day in, day out, and also, very importantly, how to do well on the shelf exam. Just like how you had a shelf at the end of like maybe most classes during your first and second year, physio shelves, micro shelf, path shelves, etc. You'll also have them at the end of your rotations. So how to do well on the shelves, they are usually like a significant part of your grade in the end, and the evaluations you'll get are also a very important part, and they'll probably go into your dean's letter, so you would hopefully want to do well on the rotation. So let's just start kind of directly just on the academic content. It'll be the core of what will allow you to perform well on the rotation, and it's also going to let you do well on the shelf if you want to. So core stuff. This book's loved, I think, almost by everyone. Step Up to Medicine. Pretty much everything you need to know is in here. I'm lying. It's not. Kind of. Okay, everything you need to know will take a lifetime to learn. Okay, I shouldn't have said that. But or you should memorize everything and up to date and read every article that's cited. But for the most part, for the third year medical student, what you're expected to know, it is for the most part in here. The thing, let me take you just like to a part that I like. I'll just pick like endocrine. Why not? And the thing about it is that it has like this outline format, so if you're like in the mood for reading a paragraph or kind of a story, it's not going to happen. No real case presentations. It's let's pick one as like an example. Okay. Ooh, I like it. Thyroid stuff's cool. Okay, so thyroiditis, and it'll have like a little bit notion here of like what it is, what causes it, what are the clinical features, how do you diagnose it, how do you treat it, and that's about it. It's to the point, it's direct, no messing around. The thing is, it's pretty much all-encompassing. It has all the key components: cardio, pulm, GI, CNS, metabolic tissue, renal, etc. It has an ambulatory section, infectious disease, two high-yield sections if you just want to know. So this is like your primary reading text when you get home. Yes, I know at the end of third year, you get home after a long, 12 hours on a rotation. You're like, oh, I'm tired, and now you have to read. I'm sorry. Get over it. I'm just kidding. It sucks, but what are you going to do? It helps if you have like a variety of patients, because you'll have to read about them anyways, because I can guarantee you'll be pimped tomorrow by someone on something about your patient. So it's just like a nice book to look up things when asked to do so, and just to kind of do your general reading. If you do start reading this, which I would highly recommend, obviously, I would don't start from chapter 1. Read the ambulatory medicine section first. It's kind of more general. It talks about hypertension, diabetes, heart disease, kind of the general stuff you should know, vaccination schedules, preventative medicine. Start from that, so do the last chapter first, then do infectious disease, cover all the old micro and pharm you forgot, and all that, because those two things are high yield on the shelves, so just as a point. And then do the other sections, endocrine, CNS, those are really important. And then I would do the stuff like the connective tissue diseases and the blood disorders and the kidney. So kind of pick more generalized and work backwards. But this book, in my opinion, gets, I don't know if we'll do the Yelp thing. If it gets 5 stars, it gets 5 stars. I don't know. I don't care. But it's a good one, and you're going to need to read something, so what else are you going to read? You're going to read that Big Harrison's book? You could. I mean, I'd be proud of you if you did, but I couldn't because it's pain. So you're reading, you're doing, you know, all that kind of stuff. So remember when we were studying for step 1, like the meat was doing questions and learning from them? So nothing's changed. The game's still the same. So say you want to do questions for your like internal medicine, your ambulatory or your family shelves. It's a book most people use. It's called MKSAP. Medical Knowledge Self-Assessment Program. Everyone will call it MixApp. That's like the cool thing. You doing MixApp, man? You doing MixApp? So this is MixApp. Welcome. Say hello to YouTube, MixApp. So this is Mix. You can tell the third year's getting to me. I'm being kind of wacky here. I'm tired. But MixApp is this. I'll just show you. So it has questions, multiple choice answers. And then per each question you have like descriptions in the back, like answers in the back with the reason of why it's right and the other ones are wrong. And what I think is really nice is little key points it gives, just high yield summarizations of what you should have got. Very useful, but not the only question bank you're going to have. So MixApp is nice for the internal medicine shelf, family, and ambulatory. The other question bank you can use is UWorld for USMLE Step 2. This isn't that many questions. I would just knock it out first and then get to UWorld. UWorld's more like random, and you have to always mix for internal medicine shelf and family and ambulatory. But this is nice. It's to the point. You'll notice like on the shelf, a lot of the questions will end with the phrase, "What's your next step in management?" This book does the same thing, so it's kind of nice. UWorld's a little bit more focused on the basic science. Maybe Step 2 is like that. I haven't taken it. I don't know. I'll let you know in a year. But it's definitely worth doing. Everyone recommends it. All medical students, all medical residents did it, so we do it too. And throw on some UWorld on top, you'll be fine. So this book, read this, do these questions, priority, and learn from them. They're very important. And try your best to read as much as you can. It's not easy, but you can do it. Links to both of these down below if you want to check them out. Okay, so core stuff to read. Now, you can't know everything. Maybe you could. Well, proud of you if you do, but you can't know everything. So, okay, so that's like the shelf component. How to pass these 3 shelves, that's kind of the summary. Do the MixApp questions, do whatever UWorld questions you can do, read as much step up as you can, and as a whole, you'll kind of hopefully do well and you'll be fine on the shelves. In addition, so that really holds true for ambulatory and internal medicine. Ambulatory is like outpatient, inpatient. The family medicine has a little bit of more like peds. It has a little bit of peds, has a little bit of OB-GYN in it. Mine didn't have too much, but I guess some people said it did. And the AAFP, Google it. That's like the association. I don't remember what it's called, but they have like this question bank for free that you can sign up for. Just becoming a member with them, just like getting a username and password, and you can do those family medicine questions. So in addition to the MixApp and these, you can do those questions. A lot of them it's free and it's more family medicine oriented. So on family, do those questions while reading Step Up, and on internal and inpatient, use the MixApp and the Step Up. Pretty straightforward, and hopefully you should do fine on the shelf. So now, how do you do well on the day-to-day rotation? I'm going to make that a separate video so this stops getting so long, because that's a generalized thing anyways. So hopefully this will help you on how to do well on the inpatient, outpatient, ambulatory, and the family medicine shelves. Let me know if you guys have any questions. Links below to the stuff I showed. And that should hopefully do it. In addition to reading, you'll be seeing patients every day, and you'll be talking to your attendings and residents, so you'll be learning on the spot, and that really comes in handy. And that's kind of all you need to do. I mean, there's not much more to it. And hopefully you remember all the minutia you studied for Step 1, because it kind of seeps in there. And that's about it. So watch out for the next video on how to just generally do well on third year. Thanks for watching, guys, and as always, enjoy your studies.